Yep.
Have a moment of silent meditation and pledge to the flag.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, we'll call this meeting of the Monongalia County Commission to order. It is October 17, 2025. This was the meeting originally scheduled for the 15th. All three commissioners are here. We will begin with consent and approval with our County Administrator, Renetta McClure. Morning, Renetta.
Morning. No exonerations today. Minutes for October the 8th, 2025. Vouchers, General County Fund, $890,736.40. Magistrate Court, $388.60. 911, $285. Chestnut Ridge Park, $9,953.38. Camp Muffley, $152.26. Mason-Dixon Park, $2,452.01. Mon County Center, $17,223.55. Recreation levy, $500,000. Opioid settlement funds, $15,197.56. Assessor's valuation, $4,214.50. Morgantown Industrial TIF, $47,673.21. ARPA, $438,860.48. Parks and Rec, $29,787.68. Purchasing card, General County, $5,311.01. Home confinement, $5,250. Chestnut Ridge Park, $1,458.06. Mon County Center, $759.85. Assessor's valuation, $788.50, for a voucher total of $1,970,492.05. We have budget revisions for the general fund that require state approval. For the County Commission, other buildings, law enforcement, civil process, jail reimbursable, jail non-reimbursable, home confinement, and other health programs. Position vacancies for the boards and authorities are listed on the county's website, and fiduciary orders for October 17th, 2025.
I move to approve the consent agenda items as presented.
Second.
A first and a second, all in favor say aye.
Aye.
All right, we have introduction of new, there's no other fiduciary items, correct?
No, sir.
Okay. Introduction of new employees, personnel changes. Sheriff's Department, representatives here from there.
See anybody here? They have Randall Spangler will be a full-time process server effective October 16th, 2025. And his salary would be $3,833.34 per month.
Move to approve the personnel as presented.
Second.
First and a second, all in favor say aye.
Aye.
Next, Youth Services Center. Anyone here from there? No, we have.
Cassie Lott and Lena Dalton. These are both relief workers, part-time, not eligible for benefits. The rate is $16.40 per hour, and they actually started on October 15th.
Move to approve the personnel as presented.
Second.
First and a second, all in favor say aye.
Aye.
Any others?
No, that's all, thanks.
Okay. Next, we'll open up our comments from the public. At this time, anyone wishing to come forward and speak, please state your name and address, and you'll have about 3 minutes to talk at the president's discretion. So, public comment is open. Anyone? Morning.
Morning.
Good morning. My name is Mindy Holcomb. I live at 13 Banner Place in Morgantown, and I am a Mon County resident. I am here about the proposed change to the benefits package for Mon County employees. I don't have any skin in this game. I'm not a Mon County employee, nor are any of my family, but I do have experience in my work quite a bit with these types of plans and insurance, and you're looking at a disaster if you move to this plan. I think the employees of Mon County are the heart of this county. They keep us moving forward, and I would assume that the three of you would like to retain quality employees, people who want to be here, people who want to invest themselves into the work of the county. And if you move to a plan such as an ICRA plan, you're going to lose quality employees. They are going to go elsewhere where they can find benefits, where they are valued. This is particularly disturbing given the time we are in right now. I don't know if your employees are aware, but if they move to an ICRA plan, if the enhanced premium tax credits are renewed, they are not eligible to use those. The ACA plans are expected, the premiums are expected to go up over 200%. Are you willing to cover that amount for each employee? If you're moving from Blue Cross to go to an ICRA plan, my guess is no. And I mean, I haven't seen the contract. I couldn't find your contract with Blue Cross Blue Shield. But I would presume as a for-profit insurance company that they're going to charge a pretty hefty penalty for ending this contract. So I would hope that has been thought through. What you're doing, if people can't afford the insurance on the ACA plan, given the stipend that they would receive through this ICRA plan, they're either going to be priced out of insurance totally or forced to choose a plan that does not meet their needs or their family's needs. And as someone who has had insurance that was less than stellar and had to pay as much as her mortgage for insulin for a year, I know what that's like. I know what it's like to have to choose between food, housing, and medication. I don't wish that on anyone. And I hope you wouldn't wish that on any of your employees. You're really putting them in a position that is going to be irreversible in some cases. Because if you can't afford good quality insurance, you don't go to the doctor. So you're looking at people who have conditions that they may not get treatment for, or the amount of treatment that they need. They're going to skip medications. And I would think that you want a healthy workforce to be here and to be ready to work and serve the people of Mon County. So I hope that you will seriously reconsider this decision. Thank you.
Thank you.
Thank you. Thank you for your input. Anyone else for comments from the public? Seeing no one, we'll close comments from the public. Moving on, Colleen Kuhn, grants. Good morning.
Morning.
All right, first up I have the grant contract for the community development block grant with us and between the city of Morgantown. That award is for $21,966.
Move to approve the contract, grant contract documents as presented.
I will second.
We have first and second, all in favor? Aye.
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 All right, next up I have requests for reimbursements. The first one is the community corrections grant in the amount of $20,145.86. Governor's Highway Safety, Safe Communities, $2,058.50. Impaired driving, $2,208.66. The Saki grant in the amount of $20,160.13. And finally, the VOCA grant in the amount of $8,408.05.
Move to approve the reimbursement request as presented.
Second.
We have first and second, all in favor, say aye.
Aye.
Thank you. Next, we have correspondence. We had letters of support we've sent out for the Alliance for Hope Appalachia, Inc., Milan Pushkar Health Right, and Monongalia Emergency Management Services. These were for the state opioid First Foundation grants, I believe.
Yes.
Correct.
And prior to a rule passed by the commission. Those were able to be sent out prior to approval at the meeting to meet a timeline, so
Yes.
we'll just,
The deadline was noon on Friday, so I
Right.
don't expect to have any more.
yeah, we had
days.
quite a few of those over the last couple of weeks, so. All right.
And just to confirm, we had one come in late during the week. That one still needs to be processed, right?
Yes.
I can't remember who that was from. Oh, it's from, it was regarding the ARC program.
Oh, okay.
So if we make sure that we address that, obviously.
Yes, we did.
Sure.
That
We
would
have
be-
put that in.
That would be, have to be as correspondence on next week's meeting, but I just remembered that
Oh,
we had that.
okay. I see it
Yes.
here. Yep.
Sounds good. All right, moving on. See no unfinished business, or actually correspondence. Did you have any other?
No, I don't.
No.
Sean?
No.
Okay, moving on. No unfinished business on the new business. Consideration of requisition number 107 for the University Town Center Economic Opportunity Development District subaccount.
Yes, sir. The requisition is for $1,234,767.01.
Okay. I move to approve requisition number 107 for the UTC Economic Opportunity Development District subaccount as presented.
Second?
The first and second, all in favor, say aye.
Aye.
And I have a couple numbers. That number that our administrator noted was less the statutory lien of $100,000 and the tax admin fees. Right now, we are trending about 28% ahead of last year's collections. So we're projecting about an additional, we're projecting $14 million in collections or $236 million in sales for an increase of about $2.5 million and $41.1 million in sales. Now, these are just estimates, but we are going in the right direction. In the last 3 months, we've had two of the top three requisitions out of the previous, this is requisition 107, of the previous 107 requisitions dating back to February of 2016.
Oh, geez.
So we are definitely pointing in the right direction. So when people question Westridge and where we're at with Westridge, that's just a little highlight that we are doing as projected.
District's in good shape, essentially.
District's in good shape.
Okay, great.
We did take the vote on that, right?
Yes.
Okay, just confirming. Sorry, I meant to say that before we actually voted. but-
No problem. Next, consideration of an appointment to the Clay Battelle Public Service District.
Yes, sir. We had David Sago. His appointment actually expires on October 31st. He submitted this letter back in July that he wanted to be reappointed. We've had it advertised since July and haven't had any other applicants, so I felt like it was okay.
Move to approve the appointment.
Second.
First and second, all in favor, say aye.
Aye.
Next, consideration of an appointment to the North Central West Virginia Community Action Association.
This one is a request by Michael Brantmeyer to be reappointed to another term.
And I move to approve the reappointment of Michael Brantmeyer to the North Central West Virginia Community Action Association.
Second?
The first and the second, all in favor, say aye.
Aye.
All right. Next, consideration of providing notice of cancellation to Highmark, West Virginia of group health insurance effective December 31, 2025.
I move to provide notice of cancellation to Highmark, West Virginia of group health insurance effective December 31, 2025.
Second?
With discussion?
To confirm that as we've been researching insurance options since last winter.
Yes.
And when we entered into the agreement, we confirmed ahead of time if we were to change courses that we'd be able to do that. So all we have to do is provide notice of cancellation. There aren't any additional fees or anything like that. So this notice serves that contractual requirement.
Just to add, for clarification, the state, there is no penalty
Yeah,
if we
that's
do it
what I
now.
mean.
That, I want that clear.
Correct.
Okay.
And we'll discuss the full parameters of this in our next action item, I imagine.
Correct.
So
Yep.
on this matter, we have a first and a second. All in favor, say aye.
Aye.
Aye. Moving on to consideration of a service agreement with Take Command Insurance Agencies, DBA, Take Command Health, to provide a software platform and related customer support services for the administration of an individual coverage health reimbursement arrangement, ICRA, plan for employee medical coverage.
I move to approve the service agreement with Take Command Insurance Agency, doing business as Take Command Health, to provide a software platform and related customer support services for the administration of an individual coverage health reimbursement arrangement and plan for employee medical coverage.
Second.
I assume we'll have some discussion with this prior to taking a vote. I'll just give a couple items before I turn it over. Probably Sean will do the heavy lifting on the statistical analysis of it, but all of there's been a lot of misinformation and flat out rumors.
Yeah, I think intentional misinformation, but
and rumors out there about what this means and what it does. I think you'll find, if you'll keep an open mind as to what we're saying, the coverage is going to be essentially the same and will probably, in most cases, be less out of pocket for the premier plan that's available by companies such as Blue Cross, which is what we modeled the plan after. I would just, I'll save another comment for closing comments, but I'll turn it over to Sean to kind of give a breakdown, if you wouldn't mind, to inform the public of what we're talking about.
And obviously, health insurance is one of the things that we spend the most time on every year researching. And in my 9 years here, we have consistently raised the bar as far as the commission contribution and consideration on behalf of the employees. And this is no different. I don't know why I continue to be amazed that every year we get so much resistance about doing things to better our employees, but it just comes with the job that we were elected to do. The problem is most of our employees will go about their busy days and not even really understand that there's a change going to effect. Unfortunately, there's a very tiny vocal minority that seeks to spread disinformation about what we're trying to do. And without facts, they're making assumptions. So what I want to do is try to clarify some of those misunderstanding. Whenever, and again, this is a product of the ACA, which I was never a fan of. But we've been, as I've said, how many years ago when it was put into effect, that if you want to make something expensive, get the government involved, or if you really want to make something expensive, try to make it free. So we've been struggling for years to try to address the medical health insurance benefits issues. We've done a lot of things. One of the first things we did was there was a premium that was charged to employees that didn't work here prior to a certain date, which we thought was completely ridiculous. We got a lot of fight about that. You know, we were trying, and instead of bringing all those employees that had a higher premium and bringing everybody up to that higher premium level, we made a decision to have everybody have the same premium level, and we brought everybody down to the same level. And we had people fighting. We had elected officials telling us that we shouldn't do that. And what that was doing is intentionally discriminating against employees that were hired here after a certain date. So again, no matter what we do through the years, we receive resistance. We went to a high deductible health plan and had a component HSA attached to it. We received a lot of criticism. The first year we only had 25 people sign up for it, and by the time that we actually were forced to do away with that plan because it was so successful and the cost kept going up, we had a majority of our employees on it. But we were told when we did that it was one of the stupidest things that this commission ever did. And 5 years later, we were criticized when we had to go away from it because it was just becoming too expensive. The ACA did away with the prior conditions requirement. So if I have insurance and I leave and change employment, when I go to another employer, he didn't have to pay for my prior conditions. And that was a problem, and that was a good thing from ACA. What it didn't do is change the prior conditions responsibility with group coverage.
Right.
So with group coverage, the dilemma of group coverage is we're tied to our performance year after year after year. If we go shop our insurance, we have to provide that experience to another prospective carrier. And as we found, year after year, we're denied.
Experience being our claims over premium ratio.
Correct. Every year, we go out and we solicit as many carriers as we can, and we're consistently denied. Some won't even provide a proposal because of our experience. So our group experience is what is driving our insurance cost, and that's what we've been experiencing year after year after year. What we're trying to do with this ICRA plan is that no longer will be the case. You go in, and instead of us dictating plans or how the plans are designed for 265 employees, each employee will be able to go in and tailor their own plan from there's over 30, I think it's 37, the last count, but
Yes.
it changes with the new year. There's 37 plans in this model with 3 different carriers. So that allows the employees to go in and look at what their requirements are and to tailor a premium around that. So currently, you have an employee that's in their 30s that just comes to work here. They have a family. Wife's about the same age. They have 2 kids. They're paying a premium that's based off of our total group costs. So they're paying essentially a penalty for our group experience. When they go in and can pick their own claim or their own policy that's based off their needs, maybe they don't use insurance, so they pick a high deductible, and it lowers the premium that they have to pay. In a lot of the cases, that premium is 0. So, based off the model that we used, and the model was we picked the plan that was closest to what we had with the previous plan year that just ended. Based on that model, of our 265 employees, 250 of them would see lower premiums or no premiums at all.
With the same essential coverage.
With the same essential coverage.
With Blue Cross.
Blue
Gold.
Cross, the health plan, or what's the third one?
CareSource.
CareSource. So that is an overall benefit to our employees. They can go in and rather than someone pay a premium that's based off the group penalty, they can go in and pick a premium that's based off of their circumstances and what they want to do. If they don't use insurance, they pick a higher deductible plan and they pay a lower premium. If they utilize their insurance and premium's more important to them, then they pick a different plan. But it's based off of their needs, their family needs, and it's fair across the board because the allowances that we have picked, we took a model and then we picked a contribution strategy that is similar to what we're doing now, and it provides an allowance. That allowance is based off age. It's based off age and what tier you're in. So you're either an employee spouse, employee children, or employee family. So the allowances are all right there. You pick the premium, you know what your allowances are, you know where you're going to be at that moment. So it allows you to really just tailor a plan that really fits your needs. Where everybody saves is there isn't that penalty anymore. And then someone that actually goes and they're looking for insurance, that prior conditions or anything aren't going to be part of it. So that you're really taking away the experience penalty that you see in group policies. So I'll stop for a second and let you guys weigh in a
Well,
little.
just a note, because the first question will be, okay, what are our allowances, and then what are the costs? And based on the modeling that's been done, they're not small allowances. There's enough in there to basically get the same coverage you have now for whatever your familial situation is, and probably be paying less a month than you're paying now. Sean's better at the percentages and the numbers. I don't want to misquote that, but there, for the most part, and obviously there's going to be exceptions to everything, but for the most part, a large majority of the employees will have less out of pocket with similar coverage that they have now. I don't want to say exactly the same
In
thing.
premiums.
Yeah, a lot less out of pocket in premiums.
Pay for premiums.
There will be, for many employees, there will be, as Sean said, there will be no cost taken out of your monthly check for premiums. And the modeling for a lot of employees will be able to get potentially get zero deductible plans
And still have none.
and still have no money out of pocket. So no deductibles, all you would have is your co-pays, whatever plan you pick. But the plan that the majority that we base this on primarily, and of course with the statistics Sean did and Renetta did the heavy lifting on that, we based it on the plan that would be the most beneficial and the least detrimental. I guess that's kind of an oxymoron to say both at the same time, but the most beneficial to the employees with the least cost out of pocket, and a large majority will see a betterment in your monthly paycheck. First off, if you're not paying that amount that you have to pay now, for some folks it's for spouse, some folks it's for kids. If you're not having to pay that out of your check to cover them, because your allowance covers all that. In some circumstances, not completely, but a large majority, you'll be in a better position. Tom?
I just want to clarify something. The rumors that you're hearing, this is not a political issue right now. This is what is the best interest for our employees in Monongalia County. And what concerns me is when you hear the raise or the increases and so on without the subsidies, that's based on the fact that the individual is going to pay that difference. What you're missing, and that wasn't said today, is we are allocating so much money, which is the same amount, similar to what we've had in the past. And see, that keeps getting lost in
An
this.
important note, just,
Excuse me.
No, ma'am, you're not allowed to talk in these
Well,
meetings.
you're gaslighting.
we're not gaslighting anything, and this isn't a time, public comment was the time to talk, but it's important to
She's not
note
even
that
employed.
the increases that are coming to insurance based on these subsidies not being renewed are already built into our plan.
Yes.
Blue Cross's rates and the other companies had to reveal their rates at the beginning of October. Those rates are the rates without the subsidies. They did not release the rates with the subsidies. So we've already built that in. So it's not like we're modeling after a plan with the subsidies and then boom, it doesn't happen and it's going to be double. We've taken that into consideration, but I'm sorry to interrupt.
Okay, so again, just want to clarify that when you look at it, and as was stated, we're looking at 224 of our employees will pay zero amount with the plan, and this is what needs to understand. We didn't just come up with these numbers. We came up with a plan that is already out there, that is the closest to the plan that we have. And then 26 individuals will be paying less. So to state that it's a disaster, it just concerns me that there's so much misinformation. I mean, we're all nervous. We're making a major change. We're personalizing your health care, and it's the same thing you would do whether you have car insurance or housing insurance. If you have a company that continually says for 3 years in a row, you're going to increase 40%, 40%, 40%, you're going to look at other options. And that's what we were looking to do, and that's what we're trying to do. And I believe once everyone looks at the plan, then they will understand a little bit better. So I'll leave it with that.
And to be clear, right now, in the current year, we are paying 93% of the cost of premiums, and the employees are paying 7%. Under the plan that we modeled, we'd be paying 98%, and the employees would be paying 2%.
Right.
of the savings that we are seeing in premiums, the county would recognize a 3% savings on what we are currently paying. The employees would see a 68% savings on what they're currently paying. And again, these are all based off the model that we picked that was closest to where we're currently at.
The Blue Cross plan.
Correct.
That was
If the employees go to a Cadillac plan with a zero deductible, we still have 64 employees that would pay less. 25% of our employees would pay less for a premium product. And there's still 51 of that 54 would pay zero. So every way we looked at this, and we tweaked it 100 times, and we wanted to make sure that the impact to our employees would be minimal and more on the plus side than on the negative side. And everything you do is going to be based off of your particular family situation. Your age, your spouse's age, your kid's age.
How many kids?
That all affects your premium. The allowances are based off of your age and where you live, state, PA, or West Virginia, in the tier that you're in. And I can't think of a fairer thing. Right now is probably the group plan we have is probably the most unfair thing.
Correct.
Because it's penalizing about 95% of our employees for about 5% of the claims. The volume of our claims, and again, and that's not throwing that 5% to out into the wilderness. They still have the ability to go in and pick a plan that best fits their circumstances.
Right. Tom, anything else?
No, I think that, I think the rumor mill will stop when the individuals actually take a look at it and see what is actually done. I think everyone just saw item D and thought we were dropping insurance. I've had calls that we're dropping insurance. I've had calls that it's an $800 increase. No. When you see what we're doing with D, E, and F, I think a clearer picture will come out.
Okay.
And to be clear, this is an iterative process. Insurance is an iterative process over the years. Every year we take a look at this and we tweak where we are, what we're doing. With this process, the first step would be getting up to speed with Take Command, who's the entity that we're utilizing to manage this for us. And then once the employees are loaded into their system, then our employees will start seeing notices and get a link so they can create their accounts, and they can go and actually start looking at the plans. They'll have they can make individual appointments with the customer support for this. And then we're also going to organize workshops, which will provide for employees to, one, research what their options are, and then come and ask questions. Same thing with different areas. There's a little special care that needs to be made to the 16 of our employees that would move over to Medicare. We would make special efforts to make sure that those employees, make sure that everything happens, that everything goes as planned, because there's a few more steps with that. And Commissioner Bloom is one of those. And, he's on board with the things and the how much better off he's going to be. As a matter of fact, he could never use his allowance.
Right.
It's not possible for him to actually use his allowance while on Medicare. So this is just the beginning. It's not the end, and there'll be a lot of informational things. We understand employees may be confused and have questions, but we'll answer those questions. But this is a start, and we weren't sure whether we were going here, but we did we took a lot of steps to make sure that the employees would. Any harm, there'd be no harm to the employees. The only hiccup is actually two sign-up periods in 1 year. But we have to do that sometime, because we have to follow, we can only follow the calendar year under this plan, which it never really made sense why our plan year went from August to July anyhow. That absolutely makes no sense. It doesn't tie in with our fiscal year. It doesn't tie in with the federal fiscal year. And it has made it, employees, when they're doing their taxes, they get two different statements. Again, this is going to, hopefully, with a little bit of discomfort as people have to sign up for their plans, but I think the overwhelming majority of our employees will see that this is a good thing and something that was done on their behalf.
Okay, so we've had some discussion. We had a motion and a second. So all those in favor, say aye.
Aye.
Aye. Next, we're on F, right?
Yes.
Consideration to approve an individual coverage notice to be distributed to county employees currently eligible for county-provided health insurance.
I move to approve the required individual coverage notice to be distributed to county employees currently eligible for county-provided health insurance.
Second.
The first and the second, all in favor?
Aye.
Aye.
And this is a step in the process where we notify the employees. So the employees will, when they're hearing about it here, this notice will be sent out, I believe, by email. And then we're also going to probably, it'll be put on ADP. We'll also probably send a hard copy to the employee's address.
home, yeah.
Yes, at home. To make sure that, again, most of our employees are going about their everyday lives and may not even be aware of this. So we want to make sure that everybody's aware as soon as possible. The process will start, the process will start almost immediately after, from the days and weeks moving on from here. So we want to make sure that we provide as much information and communication as possible.
Can I just, one question that was brought up. The employees aren't going to go out and do this by themselves. That's what Take Command is going to do, and that's where I think there's a lot of anxiety and fear. They will work with each employee individually to come up with a plan that they would like, and then they make the recommendation. You're not going out there by yourself and just doing this. And I think that's just one other thing why we went through this process, because we wanted to make sure that each individual will have that personal attention, and that's what's going to happen. Is that not correct?
Correct.
That's
Okay.
correct. Next, reports from elected officials and department heads. Mr. Petsko, Director of our Parks. Good morning.
Good morning.
Change the topic real quick.
Okay.
As you all know, I was elected to the West Virginia Recreational Parks Association Board last year with the state. With that honor, Monongalia County Parks and Rec held the state Parks and Rec Conference last week at Lakeview Resort, 7th, 8th, and 9th. We had 150 park representatives from around the state, Raleigh County, City of Huntington, Bow Park was there, Jefferson County, and during that time, we spent the 3 days learning about how to make our parks more accessible for our citizens, met with different vendors and did a lot of networking. I just wanted to make sure that the commission was aware that, these representatives from other counties were here and had a good time here in Mon County last week. Thank you.
Thank you, JR.
Did they get to tour our parks at all?
Yeah, we actually, WVU supplied us with the Go WVU charter buses, and we took those around the county and took them on site visits. The West Run Trail System was one of our site visits, and so thanks to WVU. There was also no cost to Monongalia County to host this. This was all funded through the West Virginia Parks, and yeah. Thank you.
Thanks, JR. Reports from county commissioners. Tom?
Basically, we all had to attend a meeting on the 14th, which was the MMPO Downtown Morgantown Traffic Study. In the study and the recommendations, there were 7 different alternatives, of which, of course, the public had seen really the question and concern of the closure of Grumbine Island. There are a lot of things that have to happen before then, and basically it's going to go back to the MMPO to see if we can move this step forward. But there is one area that everyone agreed on, which was the signal timing optimization and corridor coordination, which I hope we're going to be able to put in Tier 1, because that is something that needs to be done before we do even anything else. So I'm looking forward to that, and that's it.
Okay.
Sean?
Since our last meeting, the last Wednesday, the administrator and I met with the representatives from Take Command to finalize our contribution strategy. And then we had a follow-up to ICRA discussion on Thursday. Friday, we had DOH Exit 155 project team meeting, which everything seems to, again, every meeting there is deadlines, deliverables, and we are meeting those, and everything is, all the indicators are still pointing up, and we're expediting that project to make sure that we access those mega grant dollars. Monday was Columbus Day holiday, so we were closed. On Tuesday, I had our monthly breakfast, and then as Commissioner Bloom indicated, I attended the MMPO micro-simulation study discussion. And Tom's right, that micro-simulation discussion looked at all of downtown and what are the best ways that we can move traffic along, make improvements, synchronize the signaling and all that, just to better move people through the downtown. And there were 7 different alternatives that were presented. The consultants recommended one, and that the whole results of the study will come up in the MMPO November meeting, but it'll be on our agenda to vote to decide whether to put that in our transportation and improvement plan. But that particular project itself has a lot of components, and there's a lot of good things. There's a lot of people are really focusing on Grumbine Island, and because that seems to be and it's interesting when you watch these models and you watch traffic back up all these different places just because of what happens here and the unpredictable nature of the pedestrian crossings in front of the mountain there. It's really interesting to figure out how that affects so many different areas, how it affects the top of Stewart Street, how it affects Beechhurst. It's really cool to watch those models. And those models they wouldn't have been able to do those simulations 10 years ago. The simulations they did were based off of cell phone data, where they can actually track people and where where they're starting, the origin where they're starting, and the destination where they're going, and which routes they use. So it's very interesting, and I'm certainly interested in following it going forward, as far as how we can actually, rather than sit around and just talk about these things, how we can actually make changes. Yesterday, the president and I attended the community tomorrow meeting, and was very well attended. And again, I want to thank the organizers for putting that on. It was very informative, and that process continues. Yesterday, I actually was a guest of Joe Statler at his table at the Reagan dinner, and it was a really. And they had a guest speaker was Johnny Joey Jones, and I don't know. You know who he is? He works for Fox News, but he's generally on. If you ever watch The Five, he's on The Five. He's the one that always predominantly arguing with Jessica Tarloff, who is the liberal representative on that table, and then. He's got a very compelling story. He told us he spoke for about an hour, but he told us how he got into Marines, why he got into the Marines. He walked us through his accident, which he lost 2 of his legs, and then how he took that point from that point on, and really just used that to propel his life and propel the rest of his career. And as he sat there and was speaking, he said that he said something he said a lot of things that were really left an impression. But one of the things he said was he was looking out in the crowd and he was just like, but I'm sitting here, you're all sitting here probably and, listening to my story. He goes, but I'm sitting here in awe of all you. It takes a special person to put their name on a ballot, to sit out there, to serve, to take their free time and serve, and actually sit and put up with a lot of stuff we have to put up with just to serve our citizens and serve our neighbors. And today's a perfect example of that, though. We do have 265 employees that are taking health insurance that we are the most important thing to the operation of this county, and we do greatly appreciate what they do for this county, and they are very, very important. But we also have an overall fiduciary matter to the 105,000 of our residents. So we always have to weigh that. And I think we do a good job of doing that and making this a good place to work. Today is a regular meeting. We have staff reports this morning before the meeting, and then at noon I have the DOH Exit 155 project team meeting, and after that I have a local broadband team tag up. So, and that's all I have.
Just a couple things. As Sean said, he and I attended that Marl Mid-Atlantic Resiliency Link meeting last night. I spoke and reiterated the County Commission's opposition to the project, regardless of the changes that have been made. The new proposed plan isn't affecting Monongalia County as much as the original plan, but it's affecting us. And to be honest, even if it was moved out completely of Monongalia County, I don't feel, at least personally, I wouldn't change my opposition to the plan because it's anti-West Virginia. It does nothing to benefit our state, and it actually does a lot to hurt it. So I will continue the crusade to stop that line. My little soapbox there. So just a couple of comments on the insurance. It's important to note that we all are participants in the insurance plan as well. So everything that all the decisions we make affect us individually as well as affect all the employees. It's not like we're in Congress and we have one of those plans that doesn't matter what the rate goes up. It's just we have the same plan that all the employees have. So, and keeping your own personal thoughts about it out of the equation, it's very difficult. But I believe, at least for my circumstance, I try to do that, and I'm sure the others do as well. Just to assume that we don't do what we can in the best interest of the employees, I think is misguided. I think, as Sean mentioned earlier, our history with the changes and the plans we've made each time it's ended up being a positive as to what it was before. The idea of whatever the increase is has to be absorbed and just paid for 100%. It's not sustainable. Based upon the increases that we were seeing each year and projected out for the next 5 years, it was very probable that within a 5-year period, over 25% of our overall budget would have been paid for health insurance. It's just not a sustainable model. It would never have an end. This gets us in a position, I believe, that you're more with the marketplace rather than just, there's a big group, let's hit them because of the parameters or the rules that are set out. So it wasn't, this action wasn't taken lightly. Sean and Renetta, they can't even express the number of hours they put in addition to what we have as far as breaking it down. And so I think once the more information gets out there, once you see the allowances compared to what's out there on the marketplace, I think you'll be pleased. I think most of the employees will be pleased, but time will tell. So with that, I'd entertain a motion to adjourn.
I do want to say one more thing,
Sure.
and I got this from the dinner last night. Joey was talking about how he struggles with every time he runs into somebody and they say thank you for his service. He doesn't know what to say. He goes, what do I say? Thank you? And it's like, well, thank you. No, thank you. He goes, when's that stop? And he goes, so somebody told him something a couple years ago that really stuck with him, and he uses it. And I think it's appropriate here. I mean, we're not whining because we have to make tough decisions. We're proud of the decisions we made. We're proud of the decisions we make. We're proud of the effort that we do on our behalf of employees. And it's very rare when we actually get someone that says thank you for what we do. But we don't need that. I had a number of people came up to me at that meeting last night and that dinner last night and said, really thanked me for what I do, and that's enough to make this all worth it. But I would like to say that for our employees that we serve. He said that the solution was when someone says thank you for your service, he replies back, thank you for being worthy of being served. And I think that's, we do thank you for being worthy of being served. Tell our employees that and tell our citizens that. And every day we come and we sit behind these computers and conduct the county's business. We do thank all of our citizens for being worthy of being served, and this is a great community we have here, and I wouldn't want to be a county commissioner in any other county other than here. So.
Move to adjourn.
Second.
We are adjourned.
We be gone.